Is there a philosophical approach that the agency as a whole kind of adopts? And if so, can you describe that a little bit?
Well, Beacon has a philosophy of care that includes diversity. So making sure that you're involved and know.
I'm going to put some pictures on about we're talking about it as we're doing this.
That is very important to recognize the needs of the child and recognize that there's so many differences and so many layers. You have African Americans, you have Hispanics, you have whites, you have, so many different cultures, but within those cultures, recognizing that each individual is going to come with a different experience. So diversity is very key. We also have a trauma-informed approach. So recognizing that homelessness in and of itself is a trauma, and that can be such a daunting experience on that person, not to address that and not to be mindful of the fact that there is trauma, we're missing a big piece on that. And then we also have reflective practice, which is basically speaking to what are we doing, what can we do better, and we utilize that among staff who are going out into the service, going out and doing the service delivery, and we also do that with our supervisors to make sure that we're making that impression on the staff that they're seeking and they're having these conversations with the participants and letting them know, okay, well, what's working? What can we do differently? How are things going? And what can we do differently? The other one is harm reduction. And so everyday practices, we all as individuals, we engage in sometimes, some unhealthy things. Eating right, driving, not texting, things that we can do to reduce the harm for every day. So those are basically the philosophy of care that we utilize.